palpate down to the 4th to 5th intercostal space in that anterior axillary line. That's the spot. Take the large Kelly clamp and clamp the tip of the tube. The second Kelly clamp and clamp the other end of the tube to prevent fluids from gushing out. Now, let's anesthetize the skin. Make a wheel at the skin, and then you're going to aspirate as you insert the needle. You'll know when you get in the pleural space because you'll get a gush of air or fluid back in the syringe. You're gonna make your skin incision. So take your 10 blade and make a nice long skin incision. To bluntly dissect with our Kellys, the small Kellys. Remember, we're going one rib space up and insert the Kellys. It really does feel like a pop. Spread the Kellys open to create a hole in the pleura and insert your finger. So feel the inside of the ribs, feel the lungs. Now we can take our chest tube and we're going to insert it supero-posteriorly towards the apex and insert it until the last hole is all the way in. We're gonna make a simple interrupted suture on one side. Pull through so you have equal ends of suture on either side, and tie a surgeon's knot. This is your anchoring knot. Wrap the ends around the tube and tie. First I use Zeroform. Next I use gauze that I've pre-cut out. Cut the end off. Connect your tubing.
Ampule into the suction port located on top of the drain. This fills the water seal to the 2 centimeter line. To be hooked to the thoracic catheter. When indicated by the practitioner, hook up the wall suction to the suction port of the chest drain. Turn on suction and increase suction to at least -80 millimeters of mercury. You should see the orange suction monitor bellows expand beyond the triangle marks. Next, assess the quantity and quality of fluid in the collection chamber. Clearly mark the level of the fluid and mark the date and time. Next, assess for an air leak by looking for bubbling in the water seal chamber. Bubbling indicates there is an air leak somewhere in the system. Titling is the up and down movement of the patient pressure float ball in the graduated water seal chamber. With inhalation, negative pressure increases and the float moves up. And with exhalation, positive pressure pushes the float back down.
Well, by inserting the tube into this pleural lung space, it simply sucks out that air, fluid, or blood into a closed, one-way drainage system. So naturally, we must keep the drainage system below the chest level. Number 1, the suction control chamber right here. Number 2, the water seal chamber that also has an air leak gauge right here. And third, the collection chamber to measure output.